The poet Elizabeth Bishop once wrote, "The art of losing isn't hard to master. So many things seem filled with the intent to be lost that their loss is no disaster." I am not a poet. I am a person living with early onset Alzheimer's, and as that person, I find myself learning the art of losing every day.
In the year 1901, a woman called Augusta was taken to a medical asylum in Frankfurt. Augusta was delusional and couldn't remember even the most basic details of her life. Her doctor was called Alois. Alois didn't know how to help Augusta, but he watched over her until sadly she passed away in 1906. Now here's the even more striking thing. If Augusta had instead been alive today, we could offer her no more help than Alois was able to 114 years ago. Alois was Dr. Alois Alzheimer, and Augusta Dieter was the first patient to be diagnosed with what we now call Alzheimer's disease. Alzheimer's now affects 40 million people worldwide, but by 2050, it will affect 150 million people, which, by the way, will include many of you. If you're hoping to live to be 85 or older, your chances of getting Alzheimer's will be almost 1 in 2.
Dementia scares us. The confused faces and shaky hands of people who have dementia, the big numbers of people who get it, they frighten us. And because of that fear, we tend to do one of two things. We go into denial. It's not me, it has nothing to do with me, it's never going to happen to me. Or we decide that we're going to prevent dementia, and it will never happen to us because we are going to do everything right and it won't come and get us. If the monster wants you, the monster's going to get you. My dad was kind and loving before he had Alzheimer's, and he's kind and loving now. When you take away everything that he ever learned in this world, his naked heart still shines. I was never as kind as my dad, and I was never as loving. And what I need now is to learn to be like that. I need a heart so pure that if it's stripped bare by dementia, it will survive.
All my life, I've accumulated memories. They've become, in a way, my most precious possessions. The night I met my husband, having children, making friends, traveling the world. Everything I accumulated in life, everything I've worked so hard for, now all that is being ripped away. Who can take us seriously when we are so far from who we once were? Our strange behavior and fumbled sentences change others' perceptions of us and our perception of ourselves. We become ridiculous, incapable, comic. But this is not who we are. This is our disease. And like any disease, it has a cause, it has a progression, and it could have a cure. But for the time being, I'm still alive. I know I'm alive. I have people I love dearly. I have things I want to do with my life. I rail against myself for not being able to remember things. But I still have moments in the day of pure happiness and joy. And please do not think that I am suffering. I am not suffering. I am struggling. Struggling to be a part of things, to stay connected to who I once was. So live in the moment, I tell myself. It's really all I can do. Live in the moment.
Alzheimer's is a disease, and we can cure it. We need you to raise awareness that Alzheimer's is a disease, and that if we try, we can beat it.